What actually causes miscarriages? The majority of miscarriages are caused by chromosomal abnormalities in the developing embryo, something that's completely out of your or your partner's control. Here are 4 common causes of miscarriages. Genetic factors. Certain health conditions. Excessive caffeine. Drug and alcohol use. It's also important to understand that there are many possible causes behind an unexpected, one-time miscarriage, and doctors often aren't able to determine with certainty what factors were involved. Because the majority of people who experience a miscarriage and conceive again go on to have a healthy pregnancy, it's common to remain in the dark. Things may look a little different when you're dealing with recurrent miscarriage, 2 or more back-to-back pregnancy losses, at which point your doctor may be more likely to recommend doing some testing to pinpoint a possible cause and determine the best course of action. While it may be hard to pinpoint an exact reason that pregnancy loss can occur, here's what experts do know about the most common causes of miscarriage and some of the factors that may increase a person's risk of having one. 1. Genetics can cause a miscarriage. Up to 70% of first trimester miscarriages and 20% of second trimester miscarriages occur because of a glitch in the fetus's genes, according to the March of Dimes. When the chromosomes of the egg and those of the sperm fuse to form an embryo, they usually pair up correctly, says Henry Lerner, MD, an OB/GYN at Newton Wellesley Hospital in Newton, Massachusetts. But sometimes they get scrambled. If they're paired incorrectly, the embryo stops developing. It doesn't mean that anything's wrong with the parents or their genes. Because chromosomal abnormalities in embryos are often random, one-time events, they're unlikely to happen again. 2. Some health conditions can cause a miscarriage. Certain health conditions can cause miscarriage, especially those that restrict blood flow to the uterus. Chronic conditions that are associated with a higher risk of miscarriage include diabetes, thyroid disease, lupus, and heart disease. Hormone-related disorders and autoimmune disorders like antiphospholipid syndrome have also been linked to miscarriage. Certain types of uterine infections and sexually transmitted infections, STIs, can also play a role. Problems with the uterus or cervix such as fibroids and cervical insufficiency, which is when the cervix dilates too soon during pregnancy, can also lead to miscarriage. Other health-related factors include certain medical procedures such as amniocentesis and chorionic villus sampling, CVS, which carry a very small risk of miscarriage. One of the reasons why these procedures are reserved for cases where the benefits outweigh the risks. 3. Excessive caffeine may raise the risk of miscarriage. Let us be clear. 1 cup of coffee a day is perfectly fine. It's when the caffeine consumption gets a little higher that there may be a risk. Much of the conversation about caffeine and miscarriage is based on a 2008 study that found that people who consumed 200 milligrams or more of caffeine each day, about 2 cups of regular coffee or 5 12-ounce cans of caffeinated soda, had twice the miscarriage risk as those who didn't have any. And a newer 2020 study in BMC pregnancy and childbirth did find a link between increased bleeding in early pregnancy and caffeine consumption. The risk associated with caffeine is also not limited to the pregnant person. For instance, a study from 2016 published by the National Institutes of Health, NIH, demonstrated that the amount of caffeine consumed by both biological parents in the weeks leading up to conception had a significant impact on the risk level of miscarriage. 4. Drug and alcohol use can cause a miscarriage. Finally, excess drug and alcohol use can also lead to miscarriage. Exposing a fetus to large amounts of these chemicals on a regular basis can cause miscarriage because they have a poisonous effect on all those developing cells, says Dr. Schaffer. Using tobacco, alcohol, illicit drugs, or misusing or abusing prescription drugs can lead to miscarriage. Researchers note that the risk of stillbirth is raised by 1.8 to 2.8 times with tobacco use, 2.3 times with marijuana use, 2.2 times with stimulants or prescription drug use, and even 2.1 times greater risk of miscarriage from passive exposure to tobacco.